Depression. It's a word often thrown around casually, equated with a passing feeling of sadness or a temporary blue mood. Yet, clinical depression or major depressive disorder is a far more profound and debilitating condition. It's not merely a case of feeling down. Depression is a serious medical illness that profoundly impacts an individual's thoughts, emotions, physical well-being, and overall ability to function in daily life. Imagine a day where even the simplest tasks feel insurmountable. The thought of getting out of bed seems impossible, let alone engaging in work, hobbies, or social interaction. This is the reality for millions of people battling depression. It's a persistent state of despair and hopelessness that casts a long shadow over every aspect of their existence. The duration of this debilitating condition is another crucial factor that sets it apart from ordinary sadness. While sadness is a natural human emotion that typically fades with time, clinical depression lingers. To receive a diagnosis, an individual must experience symptoms for at least 2 weeks, and for many, the struggle continues for months, even years. This persistent suffering emphasizes the severity of depression. It's not a sign of weakness or a character flaw, it's a medical condition that demands understanding, compassion, and appropriate intervention. Just as we wouldn't hesitate to seek help for a physical ailment, we must approach depression with the same urgency and commitment to treatment. Depression manifests in a myriad of ways, impacting not only our emotional landscape but also our physical well-being. To accurately diagnose this complex condition, healthcare professionals rely on a specific set of symptoms outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. For a diagnosis of major depressive disorder, an individual must experience 5 or more of the following symptoms nearly every day for at least 2 weeks. A pervasive low or depressed mood, a marked loss of interest or pleasure in activities once enjoyed, significant changes in appetite or weight, either increase or decrease, sleep disturbances like insomnia or hypersomnia, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating or making decisions, psychomotor agitation or retardation, and recurrent thoughts of death or suicide. These symptoms are not merely fleeting feelings, they are persistent and pervasive, casting a dark cloud over the individual's daily life. The once vibrant colors of their world fade to shades of gray, and the simplest tasks feel like insurmountable obstacles. It's important to note that not everyone experiences depression in the same way. Some individuals may exhibit predominantly emotional symptoms, such as profound sadness or feelings of emptiness. Others may experience more physical manifestations, including fatigue, sleep disturbances, or changes in appetite. Regardless of the specific presentation, the impact of depression is undeniable. It permeates every aspect of the individual's life, affecting their work, relationships, and overall sense of self. Recognizing these symptoms is the first step towards seeking help and embarking on the journey toward recovery. While the emotional and behavioral aspects of depression are readily apparent, the underlying biological mechanisms are equally significant. Advanced neuroimaging techniques such as magnetic resonance imaging, MRI, and positron emission tomography, PT, have provided valuable insights into the brain's role in this complex disorder. Studies have consistently shown structural and functional abnormalities in the brains of individuals with depression compared to healthy controls. For instance, regions of the brain involved in regulating mood, such as the hippocampus responsible for memory and emotional processing, and the prefrontal cortex involved in planning, decision-making, and emotional regulation, tend to be smaller in volume in those with depression. Furthermore, the intricate communication networks within the brain are also disrupted in depression. Neurotransmitters, the chemical messengers that transmit signals between nerve cells, play a crucial role in mood regulation. Serotonin, dopamine, and norepinephrine are among the key neurotransmitters implicated in depression. Imbalances in these neurotransmitters, whether due to the decreased production, increased reabsorption, or altered receptor sensitivity, can contribute to the development and persistence of depressive symptoms. For example, low levels of serotonin are associated with feelings of sadness, anxiety, and irritability, while dopamine deficiency can lead to anhedonia, the inability to experience pleasure. Adding to the complexity, hormonal imbalances can also contribute to the development of depression. The hypothalamic pituitary adrenal HPA axis a critical pathway involved in the body's stress response, is often dysregulated in individuals with depression. Chronic stress can lead to elevated levels of cortisol, the stress hormone, which can have detrimental effects on brain function and mood over time. Despite the profound suffering it inflicts, seeking timely help for depression remains a significant challenge. The average delay between the onset of symptoms and seeking professional help is estimated to be over 10 years. This delay can have devastating consequences, as untreated depression can worsen over time, leading to increased impairment, a higher risk of complications, and even suicidal thoughts or behaviors. Several factors contribute to this delay in seeking help. One major obstacle is the pervasive stigma surrounding mental illness. Many individuals with depression suffer in silence, ashamed to admit their struggles or fearful of being judged or discriminated against. Furthermore, a lack of awareness and understanding of depression as a medical condition prevents many from recognizing the severity of their symptoms or acknowledging the need for professional intervention. They may attribute their feelings to personal weakness, stress, or simply a phase they need to snap out of. It's crucial to emphasize that depression is not a weakness. It is a medical condition that requires professional treatment, just like any other physical ailment. Effective treatments for depression are available, and with the right support, individuals can and do recover. If you or someone you know is struggling with depression, reaching out for help is the most critical step. Encourage your loved one to talk to their primary care physician or a mental health professional. Offer to help them find a therapist, accompany them to appointments, and provide ongoing emotional support throughout their journey.